Thank you, Mr. Speaker, and can I thank the Secretary of State for advance sight of his statement. Mr. Speaker, after 13 years of Conservative mismanagement, patients are waiting longer than ever before. Heart attack and stroke victims are waiting more than an hour and a half for an ambulance. 24 hours in A&E isn't just a TV programme, it is the grim reality for far too many patients. 7.2 million people are waiting for NHS treatment. Why? The front door is broken. People are finding it impossible to get a GP appointment, so they end up in A&E. At the same time, the exit door is broken because care in the community is not available. Patients are trapped in hospitals, sometimes for months. And in between the two is a workforce that is overstretched, burnt out, ignored by government ministers, and forced out on strike. Does this plan even attempt to get patients a GP appointment sooner? No. Does this plan restore district nursing so patients can be cared for in the comfort of their own homes? No. Does this plan see ministers swallowing their pride and entering negotiations with nurses and paramedics? No. And does this plan expand the number of doctors and nurses needed to treat patients on time again? No. The Health Secretary said a lot of things, Mr. Speaker, but he did not say when patients can expect to see a return to safe waiting times. His colleague, the Minister for Social Care, rather let the cat out of the bag this morning. She was asked, and I quote, "Is there any plan at all for when we will get back to 95% of patients in A&E being seen within 4 hours?" She responded, and I'm not joking, her answer was, and I quote, "I can't tell you that." Ridiculous. How can he claim his plan is ambitious and credible? What kind of emergency care plan doesn't even attempt to return waiting times to safe levels? It's a plan that is setting the NHS up to fail right from the start, a plan for managed decline. These targets are not plucked out of thin air. Patients waiting more than 5 hours in A&E are more likely to lose their lives. So are heart attack and stroke victims waiting more than 18 minutes for an ambulance. Sadly, that is exactly what has happened this winter. It is what happened this summer, and it has been going on since before the pandemic began. You cannot provide good care in the community, in people's homes, or in the hospital without the staff to care for people. That is the supermassive black hole in his plan published today. People. Virtual wards without any staff isn't hospital at home, it is home alone. So where is his plan to restore care in the community? Labour will double the number of district nurses qualifying every year. So can he hurry up and nick that plan too? And of course, good care in the community is not a substitute for good care in hospital. We need both now. So why, in the middle of the biggest crisis in the history of the NHS, with hospitals so obviously short of staff, is his universities minister writing to medical schools to tell them not to train any more doctors? This is ludicrous. Labour will double the number of medical school places and create 10,000 new nursing and midwifery clinical placements, all paid for by abolishing the non-dom tax status. Now, I know, Mr. Speaker, the Prime Minister might not like that last bit. The Prime Minister might not like that last bit. They're all complaining opposite, but they didn't complain when they put up income tax, Mr. Speaker. The Prime Minister doesn't like it, but perhaps this would be a good time for the Conservatives to act tough on tax dodgers. So when is he going to nick that plan? And when is he finally going to get his act together and end the strikes in the NHS? Or perhaps I'm speaking to the monkey when the Chancellor is the organ grinder. If that's the case, Mr. Speaker, then when will we get a chance to question the real Health Secretary on the strikes this one is causing in the NHS? Labour will create more front doors in the NHS. We will tackle the crisis in social care. He offers sticking plasters, and by now, Mr. Speaker, it's very clear only Labour can offer patients the fresh start the NHS needs.